Hi, and welcome back to Live Well with Dr. Mel. I'm Dr. Mel, licensed physical therapist and holistic health coach. If you haven't yet subscribed to my channel, go ahead and click that subscribe button. You'll get access to all my free physical therapy tips and tricks. In this video, I'm going to go through the physical therapy profession. For those of you who are interested in becoming a physical therapist, I just want to tell you a little bit more about it because I know it can be a big decision. It takes a lot of time and a lot of money. But I hope you leave here today feeling a little bit more confident about your decision. If you're ready, let's get started. So a lot of times people think a physical therapist works with big sport teams like the Yankees or the Jets or the Mets, but it's not just for them. Yes, a physical therapist can travel the country, travel the world, and work with sports teams or work with Olympic athletes, which is so cool. And that's the reason I actually entered the physical therapy field. I thought I would work with the athletes. But as I began to learn more about the profession, I went a different avenue. I decided to work with the elderly, people who can't kick a ball or play in a soccer field, people who are so injured that they're stuck in their homes. So I go to house to patients' homes to help those who can't get to the grocery store, who can't get up out of bed or to the kitchen for a drink of water. So it all depends on who you want to work with. You can work with the military, people who have amputations, helping them fit to get a prosthetic. You can work with disabled kids in school district. There's many options. It's not just for athletes. So if you do take the time and the energy to become a physical therapist, you have many options. You can work in an acute care hospital. You can work in an outpatient clinic. You can work in a pediatric hospital. You can work on a sports field. You can become a travel physical therapist. I actually became a travel physical therapist for 6 years. I landed in new cities all around the country where they needed me. Now I'm a home care physical therapist, director of rehab. So there's many options if you do decide to enter this field. The schooling for a physical therapist is heavy science-based. So if you like science and you like learning about the human body, its anatomy and how it works and functions, this is the field for you. There are a few cons, like there is in every field. So you do have to do a lot of documentation. So every time you see a patient, you have to document what you did and how you treat. So that is time consuming. I do love working with my patients, but doing the paperwork at home isn't my favorite part. Also, sometimes insurance companies can put a limit on how many visits you can see a patient. So a patient may still need your care, but you can't go out and see them. That's why actually I developed the YouTube channel. So my patients have the exercises on video. They can continue, they can comment on the videos. So if they have any questions, they still have access to me, even though I can't see them physically in the home. Well, all in all, I'm really happy with my decision of becoming a physical therapist. It really has provided me with the tools to help serve my community. I hope this video helps you get a better understanding of what us physical therapists do. If you have any further questions or concerns, leave a comment. I will happily respond. Stay healthy and well.